Now that it's the fall and the winter, and I think people, some people, I think are a little bit desensitized from the fear point of view of COVID, and they are wanting to reestablish some of those social connections, and there's less to go and do outside, so people are meeting, and that's scaring me a little bit. With COVID patients, we tend to spend a lot of time dealing with other questions that are running through the back of our mind. So we're wondering, are we following all of the hygiene rules? Are we distanced from the patient enough? Are we wearing the appropriate PPE? Have we done all of the things we need to do to keep the patient safe and isolated, to keep ourselves safe and isolated? It becomes a little bit more personal. You feel that you're a little bit at risk. In the 7 years I've done this job, I've never seen a nurse cry about not being able to have a family member come to the bedside and having to be the frontline person saying, I'm so sorry your family member is dying and you can't be with them. It would be really beneficial if your average Albertan could comply with the public health requests to try to put aside the fact that we are all very weary of a lot of these restrictions, and be very honest with ourselves about how we're feeling, how many people we're seeing, what type of distancing measures we're taking, how consistent we're being with masks, how consistent we're being with hand hygiene, and try to tough out the next couple of months while it's cold and while we're indoors and while we're celebrating a lot of holidays that we would normally be doing in big groups and big family situations, so that we can flatten the curve, spread out the rate of infection, so that we can manage patient care appropriately through these months that we're expecting to be a bit worse for sure.